Tonight we are going to talk about Medicare, and I will try very hard to go slow and kind of explain. It's a lot of information. Certainly, probably many things could be talked about much longer than the hour and a half that we're going to be here tonight. But hopefully this will give you a good overview of the Medicare system and how it works and how you get transitioned onto Medicare. So what is Medicare? Medicare is a federal health insurance program. And it is important to keep that in mind because your Medicare benefits translate state to state. You could be in California, you can be in Oklahoma, you could be in the state of Maryland, and if you're on Medicare, it's the same system. Unlike what you're used to currently with your health insurance, where it varies state by state, Medicare is a federal program. Medicare is for folks who are both 65 and older, and it's also for people who are under 65 and disabled. And in addition, anyone who's diagnosed with end-stage renal disease, which is kidney failure, can also access Medicare benefits. So there are those three groups of folks who may be on Medicare. I get lots and lots of questions at my office, lots of phone calls actually from people who are under 65 on Medicare, and sometimes that's surprising to people, but if you have been diagnosed with a disability, you are eligible to receive Medicare benefits as well. There are two ways that you can choose to take your Medicare benefits. For most people, they're going to go with this option one. And option one is original Medicare. Original Medicare means Part A and Part B Medicare, and those two lumped together are called original Medicare. The other piece that goes with that puzzle would be your secondary insurance. This came up at the presentation I did last week, so just because I may interchange this tonight, secondary insurance, supplemental insurance, and Medigap insurance are exactly the same thing. So when you get a lot of literature, how many people here have gotten a ton of things in the mail already in reference to Medicare? Okay, so those three terms are completely interchangeable, so they aren't different, they're the same. In this case here, I kind of laid out a few of them. But this secondary insurance could be, depending on your situation, it could be your retiree benefits. It could be a private company that you pay for a supplemental plan. And in some cases, depending on your income, it could be Medicaid. So what that secondary insurance will do is it'll fill in the gaps that Medicare is not going to pay. It's important to have this because if you don't have this, then you pay it out of pocket. And then the last piece here, which is your Part D prescription insurance. And again, this Part D plan can come from a private company that you pay directly, or it could be part of your benefits package as a retiree. And so that's the first option. That's how you would fit all those pieces of the puzzle together to make sure that you had complete coverage. The other option is to go with what's called a Medicare Advantage plan. It's also sometimes referred to as Part C. And we'll talk a little bit more about that later in the presentation. Just know that a Medicare Advantage plan kind of bundles all of those pieces from option one together into one plan that looks very similar to an HMO that you might have had experience with when you were working. So it's a different way to get your Medicare coverage. So how do you apply for Medicare? If you are already taking Social Security, so if you started taking your Social Security at 62 or 63 or 64 or whatever, your Medicare enrollment will be automatic. You'll receive a packet in the mail. It will have your Medicare card in it. If you are not taking Social Security, you will need to go online to Medicare.gov. And right there's a little tab on the side that says Medicare, and you can click and you can actually enroll in Medicare there. Or you can call the Social Security office and enroll over the phone. Social Security Administration is who signs you up for Medicare. That is part of their role as Social Security. So your initial enrollment into Medicare goes through Social Security, and actually your payment of your Part B premium, which we will talk about in a moment, actually goes through your Social Security as well. So that's their role in this piece of the puzzle. Also, if you are receiving railroad retirement benefits, you are enrolled in Social Security automatically. When you initially, what they call age into Medicare, so that means you're turning 65, you get a 7-month initial enrollment period. And this initial enrollment period encompasses the 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months after. During that 7-month period, you have the opportunity to enroll in all the different pieces of Medicare that you're going to need without receiving any kind of penalty. And it's important that when you initially turn 65 and you, if you aren't working or aren't going to be receiving benefits any other way, that you get all of those pieces of the puzzle together in that 7-month period. If you are still working and you're working full-time and you are covered under an employer's benefits, they can remain your primary source of health insurance, and you can actually choose to waive your Medicare benefits at that time and then pick them up later when you retire. And we will talk about that more as we go on. This is the Medicare card. For those of you maybe who have not seen it, they actually changed the Medicare cards last year. Medicare, your Medicare number used to be your Social Security number, and then for safety purposes, they decided that they were going to change those numbers. So last spring, they did a big rollout and everyone got new Medicare cards. So now your Medicare card number is really just a series of letters and numbers that are individualized to you. It will have your name, it will have your Medicare number, and then it will have Part A and Part B with the date that those became effective. Your Part A Medicare is your hospital insurance. So this is the insurance that's going to cover you if you are inpatient in the hospital, if you are in a skilled nursing facility like a rehab, so if you had a knee surgery and you went to a rehab afterwards, your Part A Medicare is going to cover you there. Any home health care that might be necessary after a surgery or after a hospitalization, and also if you were on hospice, it's the Part A that's going to cover those. Part B Medicare, and probably what most people use the most, is your medical or doctor's insurance. This is the Medicare coverage that's going to cover you if you go to the hospital for an outpatient procedure, when you go for routine doctor's visits or preventive care, when you go to the doctor for if you're ill or sick, and also if you use durable medical equipment. So that would be nebulizers or some diabetic supplies, knee braces, back braces, walkers, wheelchairs, things of that nature would all go under Part B. Medicare is an 80-20 system, so Medicare itself only pays 80% of whatever that bill is, and the other 20% is your responsibility to either pay out of your pocket or pay through a secondary insurance that you may subscribe to. If Medicare doesn't cover something, your secondary insurance won't cover it. So that's also important to keep in mind as you are getting services, is to make sure that Medicare covers it and to make sure that you understand how Medicare covers it. I get a lot of phone calls where people say, well, I had something done and Medicare denied it. Sometimes it's because they didn't follow the right procedures, use Medicare contracted suppliers and things of that nature. So when anytime you're having something done, a procedure or something out of the ordinary, I usually always suggest that people call 1-800-MEDICARE and just touch base to make sure that they know exactly how to access those procedures beforehand. Original Medicare does not cover dental and vision. That is not part of Medicare benefits. And subsequently, secondary insurance, traditional, just regular secondary insurance, is also not going to cover vision and dental unless you pick up a separate vision and dental plan, which would be on top of anything else that you might have. So many times when you pick up these separate insurance riders for vision and dental, they'll be very, very basic insurance plans, 2 cleanings a year, maybe an x-ray, one vision screening a year, and maybe something towards lenses. So it's usually very, very basic. Again, I talked about the new Medicare cards, and just make sure, as you would with any insurance card, that you're not giving that out freely, that you're not giving it out over the phone, that you're really just giving it to your doctor and providers of that nature, because there is a lot of fraud associated with Medicare. A lot of phone fraud, people asking for your information, they sound legitimate, and then they're making claims against your Medicare number to Medicare. So just make sure that you keep that in a safe spot. This talks a little bit more about the different parts of Medicare. So again, we already went over Part A and what that covers. That's your hospital insurance. Part A has a zero premium for most people. Part A Medicare is when you pay into Social Security when you work, that's what it's going towards, is you receiving the Part A Medicare for free. I would say 95% of people receive Part A Medicare for free. There are some folks that do not, and if you don't, it's normally because you have not worked enough quarters. You have to work 40 quarters in order to be eligible for free Part A Medicare, which is equivalent to about 10 years. So as long as you've worked 10 years, your Part A Medicare would be free. If you didn't work 10 years and you had to pay, the cost for a Part A is usually somewhere around $430 a month or somewhere in that range. Part B Medicare, again, your doctor's insurance, is going to cover things like going to the doctor, preventive care. Things like a yearly well checkup, mammogram, colonoscopy, a flu shot, things of that nature. Anything that could be categorized as preventive care is going to be covered at 100% actually through Medicare because it's considered a preventive service. Part B Medicare does have a monthly premium associated with it. It changes every year. This year it is $135.50. That Part B premium is deducted directly from your Social Security check if and eventually when you take your Social Security. If you went on to Medicare and were not taking Social Security, you do have a couple of ways that you can have that money paid. You can pay it directly. They usually send you a coupon book, or they bill you every 3 months, or you can have it withdrawn directly from a checking account of your choosing. If not, it'll just come off the top of your Social Security check each month. And again, this premium typically will change from year to year. It raises slightly. So I think last year it was like $134, so it went up about $1.50 for 2019. Part C, again, is your Medicare Advantage plans. These are kind of an all-in-one plan. They work very, very, very much like an HMO. So in order to access health care through these types of plans, you do have to use their contracted providers and facilities. If you've been involved in an HMO through an employer, then you probably have a good idea of how that works. If you choose to sign up for a Medicare Advantage plan, that insurance actually becomes your primary insurance and Medicare becomes your secondary. And we will discuss Medicare Advantage plans a little bit later in the presentation, but that just kind of gives you an idea of how those work. Many times Medicare Advantage plans have very low upfront cost. We have very few options in Harford County for 2019 for Medicare Advantage plans, but for the ones that we do have, I would say on average, the monthly upfront premium is about $70 or less a month. So your upfront cost for those types of plans can be somewhat more affordable. You do still pay the Part B premium though, so it would be the $70 plus that $135.50. And then last, Part D, this covers your prescription drugs. These plans are also covered through private insurance companies that contract with Medicare. And we have about 20 or so different plans that are available this year. The average premium, the average monthly cost for having that insurance, this year they averaged at about $35 a month. There are certainly less expensive plans out there. I've seen some plans as low as $14 a month. So it really just depends on the plan. So a little bit about Part A Medicare. Again, there's no premium for most people, so they wouldn't pay anything for this insurance. There is a deductible associated with Part A Medicare, and it's $1,364. And it is not a yearly deductible, it is a per hospital admission deductible. So what that means is if you were to have more than one hospitalization in a year, you would pay more than one deductible in a year. Many times, as part of a supplemental insurance plan, one of the benefits that you would receive through that plan is that they would pay your Part A deductible. So you wouldn't be responsible for it out of your pocket. But just know that this isn't a yearly deductible, it's a per hospital admission. This deductible typically changes year to year. It usually raises a bit, not significantly, but by a few dollars each year. This inpatient hospital stay deductible would be for any hospitalization that was 1 to 60 days in length. And so then underneath here, it just kind of gives you the breakdown of what your cost would be if you had a hospitalization beyond 60 days. And you can see that your portion of that goes up the longer you're in the hospital. There is a lifetime reserve days, which is about 150. So anything over 150 days in the hospital, which hopefully would not happen, you would pay 100% of. Another important thing to remember is that there is no out-of-pocket maximum for Medicare. So there is no point during the year where Medicare says, you know what, you have paid plenty, you're good now. No, that doesn't happen. So as you continue through the year, if you had a year where you sought out a lot of medical attention, there's no point where you have met a cap. You would just, keep paying that 20% or be responsible for that 20%. The more that you used. Part B Medicare. So again, for 2019, the premium is $135.50. That will change for 2020. This premium can actually be higher depending on your taxable income. And this is one of the handouts that I didn't put out front, but that you're welcome to pick up at the end if you think this applies to you. It's over here on the table. How many people in here have heard of the term IRMA? Okay, so IRMA is what they figure on if you make a higher income. And for 2019, that income that they're looking at is for 2017. It always goes back 2 years. And I have a little chart here that will kind of give you an idea. So just to give you an idea, if you kind of fall into this bracket, if you as an individual for 2017 claimed $85,000, around $85,000, you would be subject to this IRMA. And what it does is it adds a bit more onto that $135.50. So let's say you claimed $87,000 in 2017. You would pay an additional $12.40 on top of the $135.50. And that kind of goes up the higher the income goes. That IRMA premium adjustment also comes into play with your Part D prescription coverage as well. So if you're subject to this IRMA, you're actually subject to it in 2 places, both Part B and Part D. So there is I do have a handout over here on the table that gives all those different breakdowns. If you think that you fall into that category, you're welcome to pick one up. A couple things to to keep in mind with the IRMA. It does go off of, again, taxes that were 2 years ago. So if you, in 2017 were subject to this, it may drop off depending on what your, the following year's taxable income was. If you, say, had some very odd thing that happened, an example I'll give you from the last presentation, there was a lady there who retired, and upon her retirement, she was paid out for a big chunk of sick time that she had not used while she was working. And because of that, it pushed her into this bracket. Of course, the following year, she didn't have that. So she was able to do, you can actually fill out a form to have them look at your income the following year and drop that IRMA off if it needs to be. So, if you get subjected to it 1 year and your income changes, that could change the following year. So again, those are over on the table if you think you need one of those. There is a yearly deductible, and this is a yearly deductible for Part B, and that's $185. And that you just pay once. Once you meet that $185, then you're good for the rest of the year. Again, that adjusts as well, so that will probably be higher next year. Again, Medicare is an 80-20 system, so you're responsible for 20% once Medicare pays their 80, and that can be paid by you or through your supplemental insurance. You can also be subjected to a late enrollment penalty with your Part B Medicare. So if you do not sign up for Part B when you should have during one of these enrollment periods or one of these special circumstances, and we'll talk more about what those are, you can be subjected to a late penalty for that. They calculate a Part B penalty in the following way. However many months that you did not have it, so let's say, for instance, you went a year without Part B when you should have had it, they take 10% of the premium and add that on to your premium when you do sign up. So if you went a year, you're looking at $1,350, so it would be the premium plus $1,350, which doesn't seem like a lot. I've worked with people in my office who didn't have Part B for 10 years. So, and then signed up for it and had to be assessed that penalty. That penalty does not go away. So if you get a Part B penalty, you'll pay it for the lifetime that you're on Medicare. So it's important just to make sure you sign up for things whenever you are in those special circumstances that don't subject you to a late enrollment. Again, your Part B can be paid either by being deducted automatically from your Social Security benefits. If you're a federal employee, it can come out of federal retirement benefits. It can come out of a railroad retirement benefits if you receive those. If you do not get Social Security, you can be billed every 3 months. You can have it deducted monthly out of a checking account. You would set these payments up with Social Security. So again, you can go on their website, download a form, and mail it in, and they can set that up. Usually they'll call you if they have any questions. I find that in working with people, sometimes it's easier if you have access to the computer to do a lot of your work with Social Security via their forms on the computer, because how many of you have ever gone there and sat for, 3, 4, 5 hours? Yes, so sometimes it's easier just to do it online, and then they'll contact you and let you know either in writing or on the phone that everything went through. So again, some things to think about with Part B. The premiums can change every year. They usually do. If you have limited resources or income, there are some federal programs in each state that can help to pay for your Part B premium. And these are called, there's actually two, they're called Medicare Savings Plans. They're a form of Medicaid. There's one called QMB, it's short, it's initials for a much longer name, and SLMB, and both of those will pay your Part B premium. Just to give you an idea of what income we'd be looking at, in order to access the QMB services, you can't make more as an individual than $1,045 a month. And to receive the SLMB benefits, you can't make more than about $1,400 a month as an individual. So if you think that you or even someone you may know that's on Medicare would benefit from that, you can download those applications right online through Social Services. That's who runs those two particular programs. And again, I talked about the penalty. So, so you just want to make sure that you sign up when you can. So when can you enroll? When you turn 65, you can enroll. If you're given official disability status, you typically will become eligible for Medicare after 23 months. Then you can enroll. If you have ended your coverage with an employer and you're 65 or older, you can enroll in Medicare. And again, if you have end-stage renal disease, you can also receive Medicare benefits. It is important to enroll in Medicare when you are old enough and you need it for several reasons. The first reason is that if you wait to do it, you could be subject to late enrollment penalties, which you don't want. Also, the premiums go up every year. So the later you wait to enroll, the more of a premium you will pay, which, it may only be a few dollars, but it will be higher. Your coverage may be affected. So let's say, for instance, you retire, your coverage through your employer ends May 31st, and you wait until July to go to Social Security and take care of enrolling. You've left yourself in a coverage gap. And you are basically without insurance for a month, so you do want to make sure that you get all of that done in a timely fashion. And the other thing is that when it comes to supplemental policies, I have it listed as Medigap policies here, same thing. Your best rate, the best cost that you will get, is when you are either initially turning 65 or when you retire. And so you really want to be looking for those types of plans during that time so that you can get your best price. And if you wait outside of those two particular situations, you will be subject to some medical underwriting at that point, and they'll look at your pre-existing conditions and things of that nature, and you may find that your rates have gone up quite significantly. So you really want to take care of everything in that 7-month period if you need to access your Medicare at that time. So this little chart here is very important because I know I've said, during that 7-month period. In all honesty, If you are turning 65 and you plan to pick up your Medicare benefits at that time, you really, really, really want to take care of all of it in this first 3 months. And I'll tell you why. If you look at this chart here, you can see that if you enroll and get everything together within those first 3 months, all of your coverage will begin the first day of the month that you turn 65. If you wait even until the month that you turn 65, your coverage will not take effect until the following month. And every month you may wait beyond that will be a month later. So let's say, for instance, that you turn 65 on June 1st. And so your 7-month initial enrollment period started March. So as long as you go and file with Social Security to take your Medicare in March, April, or May, your benefits will begin June 1st. If you wait until June, your benefits will not start until July. And if you wait until July, August, September. So you could potentially go several months without health insurance if you don't really take care of everything in these first 3 months. So this is kind of a Hail Mary, if you will. Like, oh no, I forgot, but I still have time before I'm going to get a late enrollment penalty. You really want to be taking care of those things here. So how many people in the room right now are in your 7-month window? Okay.
What do you mean by that?
So the 3 months before your 65th birthday, the month of, and the 3 months after. During your initial enrollment period, you can enroll in Part A, enroll in Part B, pick up a Medicare Advantage plan if you choose to take one, pick up a Part D prescription plan, and shop for and enroll in a supplemental plan. So you can do all of those things during that initial enrollment period. Truthfully, you want to do all of that in that 3 months prior to your birthday, just to make sure everything starts the month of. There are no late enrollment penalties associated with those 7 months. So as long as you do everything within those 7 months, you're fine. So there are a lot of different enrollment periods or different special periods associated with Medicare. We just talked about your initial enrollment period. That's that 7 months around your birthday, your 65th birthday. Medicare also has a general enrollment period, and this happens every year, January 1st to March 31st. During this time, you can enroll in both Part A and B Medicare if you needed to. You can also change or pick up a Medicare Advantage plan during this time. And any changes or anything that you do during this January 1st to March 31st, those benefits do not actually take effect until July 1st. So if you went in to make changes or to sign up for something in January, know that your benefits would not actually kick in until July. So you'd still have about a 6-month sort of period of time there without insurance if you didn't already have it. There is also a yearly open enrollment period, and this is the one that most people equate with Medicare and are familiar with. This is during October 15th to December 7th. This is typically when you start to see an uptick in all the advertisements about Medicare, because this is when you can change prescription plans, your Part D. And you can also, again, sign up for Medicare Advantage plans during this time as well. This is a really great time of year to look at your Medicare prescription plans, because we usually advise to folks that if you are receiving prescription coverage through a Part D prescription insurance through Medicare, that you review it every year during open enrollment, October 15th to December 7th. Why? Because those plans can change, and they can change pretty dramatically sometimes year to year. They can go up in price. The monthly premium can change. It can become more expensive. Medications that you take can sometimes drop off of a company's formulary, meaning the list that they put together of medications that they cover, sometimes they change that. And so something that you may have been taking that was a generic, they may move it up the tier and make it a more expensive medication. Deductibles can change. So again, you want to review this information to make sure that at the end of the day, you're getting the best coverage for you and your medication needs, but also at the cheapest price, because you don't want to pay more than you really need to. I have had phone calls in the past during this time of folks who have just, let their prescription plan roll year after year after year. And when we finally review it 5 years later, they're paying hundreds of dollars more a year than they really needed to. So you definitely want to be looking at this during October 15th to December 7th. Any changes made during this open enrollment period take effect January 1st. So it starts at the beginning of the year. If you have many times through retiree insurance, so insurance that you'll receive as part of a retiree package, many times that insurance will include prescription coverage. So if yours does, you wouldn't have to be worried about picking up a Part D. And this is something to keep in mind because I have people ask me this sometimes. They will go on to the Medicare Plan Finder and look at these Part D plans and find that sometimes a Part D plan is more cost effective or covers their medications better than what they're receiving through their retiree benefits. And then they'll call and say, well, I want to change. And, you're welcome to do that, but it can affect all of your insurance. So, prior to making any kind of decision like that, you would want to check with your benefits coordinator for those retirees. So say you retired from the county, you'd want to be calling the human resources for the county to make sure that you could, say, potentially drop their prescription coverage to pick up Medicare's. Because I've seen many times where those two things are linked, and you cannot drop one without the other. And you wouldn't want to leave yourself without that coverage. So keep that in mind going forward. Sometimes you can also qualify for a special enrollment period through Medicare. This would happen if you moved, if you got divorced, say, and you were losing your benefits because they were through your spouse, if your insurance company leaves the county or no longer is providing coverage to this area. In those instances, this would qualify you for a special enrollment period. The other thing that will qualify you for a special enrollment period is retiring. So if you turned 65 and you were still working full-time and receiving coverage through your employer and opted to waive your Medicare at that time, when you retired, you would automatically fall into a special enrollment period and be able to pick up any of the pieces of Medicare that you needed and without subject to any kind of late enrollment. So for many of you in this room, that may be you. You may not be intending to take Medicare because you're still going to be working. You have an 8-month period to pick up whatever pieces of Medicare that you're interested in after you retire. So you don't have to feel rushed, but again, keep in mind, the longer you wait, the more of a gap. If and when you decide to retire a couple months prior, it is a good idea to go talk to that benefits coordinator and ask them, how does this retiree insurance work? What does it cover? How much does it cost? It can many times be slightly higher than what you're currently paying because many times employers tend to pay less towards the retiree portion and you would pay more. So you want to find all of that out. You also will need to get a letter from them proving that you had insurance during the time between when you turned 65 and when you retired, and you will present that to Social Security when you enroll in Medicare so that they don't try to give you a late enrollment period. So your employer should be familiar with that and be able to do that. So you definitely want to find out, how long does my insurance keep in effect after I retire? Do you have till the end of the month that you retired? Are they going to give you maybe the month after? It really just depends. So that you want to keep in mind too, so that when you go to Medicare to enroll, you can have that effective date start the first of the month immediately after. So it's a seamless transition. So if your employer insurance ends May 31st, your Medicare is picking up June 1st. Does that make sense? So a little bit about supplemental plans. This is usually the thing that I get the most questions about at my office. Supplemental plan, secondary insurance, Medigap, all the same thing. These are private companies that are contracted through Medicare to provide additional insurance to you to help cover the things that Medicare does not cover. Because again, Medicare only pays 80%. So if you do not have any form of secondary insurance, you will receive a bill for the 20%. Where does the bill come from? It comes from your doctor, it comes from the hospital, it comes from whoever provided the service. It does not come from Medicare. If you have a secondary insurance, when you go to the doctor bills Medicare, they pay the 80%, the rest of the bill goes to your secondary, they pay the 20%, and hopefully you pay nothing. Now, I say nothing lightly because you are paying for the insurance, so obviously you're paying something, but you're not getting a bill from the doctor. You must have Part A and B Medicare to be enrolled in a secondary insurance. It will not pay what Medicare doesn't cover. So if Medicare doesn't cover it, your secondary insurance is not going to cover it, with the exception that some secondary insurance plans will have as a benefit emergency health insurance if you are out of the country. Because again, Medicare doesn't cover you out of the country. So if you're on a whirlwind cruise around the world and you fall down and break your leg, Medicare is not going to cover. But your secondary insurance, if you have a plan that does, will pick up for some emergency care. That's the only instance really where a secondary is going to pay when Medicare is not paying. A Medigap policy, a secondary policy, covers one person, and that's really important because all along when we have insurance, you can sign up for individual, family, individual and spouse. That's not the way Medicare works. Medicare works individually. So when you pick up a prescription plan, when you pick up a secondary insurance, that policy covers one person. So when you talk to these companies, you will need to, make sure that, don't forget your husband or wife, I guess is what I'm saying whenever you're calling them, because you want to make sure they realize there's two people. You could have a husband and wife could have two completely different insurances beyond the actual Medicare A and B, depending on what their circumstances are. And we see this a lot, especially with prescription plans, where one spouse may have one company and another spouse another, because their medication needs are different. That can be the case with a supplemental as well, although many times the secondary insurance companies will sometimes offer a slight discount if you have more than one person in the family that has a policy through them. You pay your monthly premium directly to the secondary insurance company. It can be deducted from a checking account, much like Social Security or your Medicare can be deducted from a checking account, or they can bill you quarterly, or a lot of times they'll send a little coupon book that you mail in each month. If you don't remember anything else that we say tonight about Medigap plans, here is what you do want to remember, because this will save you money. Medigap plans are lettered, much like how Medicare is lettered, just to be, as confusing as possible. And the thing you want to keep in mind is that companies that offer these types of plans are contracted through Medicare, and they are subject to the rules and regulations of Medicare through laws and regulations. Medicare supplemental plans are standardized, and what that means is that if a company, so say you have United Healthcare, which is AARP, and Aetna, and they both offer a Plan F, it is exactly the same plan. There is no difference between the coverage through those two companies because they are standardized. They cannot have a difference. So Aetna is not going to offer you something that United Healthcare is not. They're exactly the same. What can be different is the price. So it is very important, particularly during your initial enrollment period or a special enrollment period that you may get, to shop for one of these policies as thoroughly as you can. And I don't mean call 17 companies and overwhelm yourself, but a lot of times I'll have people come into my office who will say, my sister, brother, cousin, neighbor, friend has United Healthcare. That's the one I usually always get, and that's who I want. And I will tell you through my experience in looking at these plans, there's nothing wrong with United Healthcare. It's great. It does tend to be one of the more expensive policies. And it may, another company may serve your needs just as well. The other thing is that people will say, well, my friend has this policy and they're only paying $180 a month, but when I called, they told me it was going to be $300 a month. And that is because when you initially age into Medicare and you are in either your initial enrollment period or a special enrollment period, you are in what's called a guaranteed issue. And what that means is that when you call these companies, they cannot base your rate on your gender, on any pre-existing health conditions that you may have, well, they can base it on age, and I'll tell you why. But that is very important because then you're getting what a lot of times they'll call the preferred rate. And it's just whatever the cheapest rate is that they can give you. If you wait to pick up a secondary plan and say you've been on Medicare for a year and a half already, and now you decide, I'm tired of paying this 20% out of pocket, I'm going to pick up a secondary plan. You are no longer in that guaranteed issue. When you call that plan now, they're going to ask you questions about your health, man, woman, whatever, and they're going to base your rates on those questions, and they may be significantly higher than what you would have gotten had you picked up a plan a year and a half. So don't judge the plans off of what a friend has because, depending on when they picked it up, it's not going to be the same for you. The other thing to keep in mind is that in the state of Maryland, like 99% of our plans are what's called age attained rated. And what that means is as you age, the policy gets more expensive. And it usually happens in 5-year increments. So the lowest rate will be at 65. There's a jump at 70, 75, 80, so on and so forth. I want to say 85 is like the highest that it goes. So again, when you turn 65, you're going to get the lowest rate because you're at the lowest age bracket. So again, that's why you want to shop for them now. Can you change supplemental plans? Sure. And there's no open enrollment period for these plans. You could call anytime during the year, but you're not going to get the best rate anytime, So you really want to do your due diligence now when you're shopping for these plans and get the best rate that you can. Because the cheaper rate you can get now, the better off you're going to be in the long run. There are no co-pays with Medicare. So unlike what you might be doing right now where you go to the doctor and you pay $20 for a regular doctor and $40 for a specialist or whatever, that doesn't happen with Medicare. When you have Medicare, again, the billing happens. Medicare is the primary. If you have a secondary, it goes to them. You're not going to pay anything up front at the doctor's office. The bill would come on the back end if you owed anything. Not all companies have to sell all the plans, but again, if they do sell the plan, it has to be exactly the same. So a few things about the plans. I listed the ones that are currently being sold. Now, as of January 1st, 2020, there will no longer be a regular Plan F that is being sold. So what does that mean? It means if you pick up a Plan F now, you will be grandfathered in and you will continue to be able to have that. If you or someone who turned 65 in 2020 tried to pick up a Plan F, it would not be available to them. Medicare does this every once in a while. If there are several plans that are very, very similar, then they'll drop one so that there's not a lot of options out there that are basically the exact same thing. With that in mind, there's a couple things to think about when it comes to these supplementals. Plan F happens to be the most comprehensive plan in the things that it covers. It's also the most expensive. So it's a good plan. It covers a lot. It leaves you with very, very little, if any, out-of-pocket expense on the back end. There is another plan. It is a Plan G, and it's very similar. The only thing that it does not cover that Plan F does is your Part B deductible. But it can be significantly less expensive. And there is one plan, I know I just said you don't pay co-pays, but there is one plan, a Plan N, and through that supplemental plan, you do pay co-pays. And that's just assessed through the supplemental. So when you're pricing these out, if you go on the Maryland Insurance Administration website, you can get some very basic premium rates for different companies there to kind of see about how much something will cost you. And depending on what plan you go with, the price could be anywhere from, I've seen $120 a month up to $300 a month. It really just depends on the company and the plan. So a few things about a Plan F just to keep in mind. This is not to deter you from getting a Plan F because you certainly still can. You have up until the end of the year. Only thing to keep in mind with the Plan F, because they are phasing Plan F out, anyone who is in a Plan F will be able to stay. However, as of the end of 2019, no one new will be added to that pool of applicants. And what that means is that the money that is within that Plan F pool will not grow. And the only way for it to grow is for the current subscribers to pay more. So for anybody who is in a Plan F, you may find that your rate is increasing at a higher capacity than other plans, because again, no one's adding to that besides the players that are already there. So that's just something to keep in mind as you're pricing these out. These plans rates are going to increase regardless, but obviously you want to pick one that's going to increase at a lower rate. If you want more information on these types of plans, again, the Maryland Insurance Administration is a really great resource. They have a booklet that they put out every year that gives you some basic plan rates for all the different plans. I will warn you, it's 100 pages long. It can be very overwhelming. So, this is usually what I tell people. Figure out about how much you can realistically afford to pay for a supplemental plan, and put that number in your head and flip through the book and find the companies that have that rate, and then call them. Because, if you look at the book and you want to spend $150 and this plan's $200, there's really no point in calling them. So, kind of figure out your budget first and then look into them. So this talks a little bit again about when should you buy these Medigap plans. Best time is when in that 7-month initial enrollment period, when you are turning 65. Your next best time would be in a special enrollment period when you have kind of a life circumstance that allows you to get another guaranteed issue. And again, you can buy these policies any time, but those are really the best times to do that. If you wait to buy a supplemental plan until you've already been on Medicare for a while, and you have a pre-existing condition of some kind, so let's say you have a heart condition, sometimes what these plans will do, if you're not in a guaranteed issue, is they could deny you coverage. They could say, no, we just aren't going to cover you because, you have significant health issues. The other thing they can sometimes do is they can put you on a 6-month waiting period, and what they'll do is they'll say, okay, we will allow you to subscribe to our plan. We'll cover everything but things having to do with your pre-existing health condition. So if you have, say, a heart condition, then anything that was related to the heart condition for 6 months, that supplement won't pay. And they can do things like that if you're outside of those guaranteed issues. So it's a good idea to, shop now. I've said that like 8 times, right? So that'll be like the one thing you remember. A little bit about the Part D prescription plan. Again, if you have retiree insurance and it includes prescription coverage, you really won't need to pick this type of plan up. If you do not have any other prescription options through a retiree benefits or something along those lines, you would need to pick this up. They are available to anyone with Medicare. Again, they're run through private companies that are contracted with Medicare. So any changes or regulations that Medicare decides for their prescription coverage, all of these companies have to adhere to. Again, you can get them individually as just a Part D plan, or if you have that Medicare Advantage plan, a lot of times those prescription insurance, the prescription coverage is included with the Advantage plan. The average monthly premium for 2019, they said, was about $35. I've seen them be less, but that's a good idea, or that's a good suggestion for a price. There is a yearly deductible. Most plans have a yearly deductible. I think the average in 2019 was about $415. So what does that mean? The deductible for prescription plans works just slightly different. Your plan can have a deductible, but if you only take generic or preferred generic medications, you don't have to pay into the deductible. The deductible only applies to higher tiered medications, specialty medications, compound medications, more expensive medications. So I definitely have had folks sign up for plans with deductibles. They only take generics and they never have to meet the deductible the whole year. So sometimes the deductible is in a breaking point for picking a certain plan. Each plan decides what the copay for the medication is. So in other words, each plan decides when you go to the pharmacy how much you're going to pay for that particular prescription. So depending on where it falls on the tiers for that plan will determine your cost. The cost can be anywhere between $0 and hundreds of dollars I've seen for some more specialty medications. So that is why I handed you that PowerPoint presentation for Welcome to Part D Medicare. If you need to pick up a Part D prescription plan, you can go onto the Medicare.gov website and you can click on their plan finder. And it'll walk you through the steps of putting in your medications and your Medicare information, and it will spit back out to you the best plans for you based on what you put in. So when you do it, you definitely want to put in all your medications that you take. And it will list them automatically cheapest to most expensive. It gives you a yearly overall cost. That yearly cost encompasses the monthly fee to have the plan as well as how much you'll pay for your medications. So you can kind of get a feel for that. Many times you can enroll right through the computer or you can call them on the phone and enroll. For the Part D, you can also be given a late enrollment period for Part D. So sometimes people, because it says, you have the choice to sign up for Part D, and you do, but not really. Yes, you have the choice to sign up for Part D. You are welcome not to. If you don't sign up for it and decide 5-10 years down the road that you should have it because now you take a bunch of medicines, you will be assessed a penalty. So it's kind of like, do it if you want to, but we're going to get you on the back end if you don't do it when you should have. So this penalty is slightly less. It's 1% of the average monthly premium for every month that you did not have a prescription plan and should have. So again, we had somebody come in the office the other day, and I think he had been eligible for a prescription plan for something like 20 years, and he had never had one. So when he signed up for it, I think his penalty was like $45, which, is higher even than what the premium was, sadly. So yes, so Part D, you're going to want to sign up for it as soon as you can. And again, depending on when you turn 65, this definitely happens where somebody turns 65 in November or say September, and they pick up a plan, and then open enrollment starts in October, and you could change if you wanted to. That happens sometimes, because again, those plans change every year. So when can you change plans? Again, during that open enrollment period of October 15th to December 7th, you could change plans. If you qualify for a special enrollment period because of some unforeseen circumstance, you could sign up for one then. And again, it's important to review this every year. Even if you do not take any medication, you want to sign up for a prescription plan. Just sign up for the cheapest one there is. Because, again, you're going to accrue a penalty for every time that you don't have it, and you really just don't know. So you might as well pick one up, and then you're covered, and you don't have to worry about it one way or the other. The PowerPoint, it does walk you step by step through how to use that plan finder. The only little side note, and it says it in the PowerPoint, but I'll say it out loud. If you choose to use the plan finder, make sure that you actually type Medicare.gov into the search engine. Do not Google Medicare, because when you Google Medicare, the actual site is like the 5th thing down on the list, and the first 4 things are ads. And you don't want to inadvertently put your information into something that then is going to be sending you tons of junk mail and calling you on the phone. Okay, so here's the Medicare Advantage plans, and I'm not going to get into a ton about this, namely because a lot of people don't choose these, and we don't have a lot of choices in Harford County. These plans can come and go every year. So in 2018, we had 4 or 5 different options. For 2019, we have 2. Kaiser Permanente and Cigna, and that's all that we have by way of Advantage plans. Now, that's not to say that in 2020 we might not get a new plan. We certainly may. Advantage plans can differ from state to state and county to county. So in Baltimore County, I think they have a Hopkins plan, and we don't have that here. So how do these work? They work like an HMO, as I mentioned before. They become your primary insurance if you choose to sign up for one, and Medicare becomes your secondary. And does that matter? Yes and no. It really shouldn't matter because they're going to cover most of what Medicare covers. However, they may cover it differently. And let me give you an example of this. We had someone call the office back in the fall because she received a hospital bill that was pretty significant. And she was very disturbed because she said Medicare covers the first 60 days. Well, guess what? Her Advantage plan did not cover the first 60 days. It only covered the first 30. And because they're her primary insurance, that took precedence over Medicare. So in that instance, she actually ended up paying more by having that Advantage plan than if she had had regular Medicare. So that is just something to keep in mind. If you're interested in a Medicare Advantage plan, the pros are they can be a lot cheaper up front. You almost kind of pay for your health care as you use it, which is great and fine if you're a relatively healthy person and don't really go to the doctor that much. If you're somebody that has pre-existing health conditions or you see a lot of specialists and doctors, you can put a lot of money out of your pocket because you're going to have co-pays, you're going to have deductibles, you're going to have certain amounts that you have to meet via these plans. So if you think that it's something you're interested in, call the plan directly and have them really explain to you exactly how their benefits work so that you know at the end of the day what your costs are really going to be. The benefit or the sort of lure of these plans is that their upfront costs can be very, very low. I think there's a Kaiser plan that might actually even be free or like $30 a month up front. But again, you're going to pay co-pays and you're going to pay deductibles for the services as you use them. So keep that in mind. You do have to use their network. So if you have doctors that you've been with for a long time and they don't accept Cigna, and probably they don't accept Kaiser because Kaiser is a very closed network and they employ their own physicians, you'll have to change doctors in order for these insurances to cover them. You still have to have Part A and B Medicare. You're still going to pay for Part B Medicare. There's very few Advantage plans that pick that cost up for you. One thing, though, I will say that's different between an Advantage plan and regular Medicare is there is an out-of-pocket maximum with an Advantage plan. So with most Advantage plans, you will not pay more than $6,700 in a calendar year. So they'll cap you off. So if you had something happen that year and you spent the $6,700, you're not going to pay anything more, which if you remember from the beginning of the presentation, Medicare does not have an out-of-pocket maximum. So there is that benefit there. Sometimes these plans will include vision and dental, some very basic vision and dental as part of their package, and many times they also include prescription coverage. So, it's kind of an all-in-one deal and you're not dealing with a bunch of different companies, which can sometimes be appealing to folks. You cannot have a supplemental insurance and an Advantage plan. You'd have to choose one or the other. And again, I kind of talked about this a little bit. They're going to vary plan to plan. Cigna actually has 2 different plans available in Harford County. The benefits of the plans are slightly different. Same with Kaiser Permanente. So, you can call the company and ask for the differences between the 2 plans. This chart here gives you a comparison really of just if you went with a supplement or you went with a Medicare Advantage plan. I won't go over this too much. You can look at it at your leisure depending on if you were really tossed up between those 2 things. This slide here talks more about those the programs that are out there that help cover Medicare costs. These are income-based, so primarily folks who are low income would benefit from these. There are 2 programs here that help actually pay the cost of your Medicare A and B, and then these 2 at the bottom help towards the prescription cost. Extra Help is a program run through Social Security. It pays your premium for your prescription plan and it keeps your co-pays for your medications very, very low. I think you can make as much as $1,500 a month as an individual and qualify for that particular plan. It does have an asset limit though of I want to say $14,000, so you can't have more in assets than $14,000. We do have a state plan. The Senior Prescription Drug Assistance Program, shortened to SPDAP is what we usually call it. That program in particular only covers the monthly premium up to $40 for your plan. So it's not going to affect the cost of your actual medications, but it will pay the plan for you. If you think you're eligible for that, or again, if you know someone that you think might be eligible, I do have applications for the state plan over here and you can pick one up. The other benefit to enrolling in a prescription plan, in a plan that helps pay your prescription costs, is it gives you the perk of being able to change prescription plans outside of open enrollment. So for folks who are receiving assistance through the Senior Prescription Drug Assistance Program, they can actually change their prescription plan at least one time in the calendar year outside of open enrollment. So sometimes that's beneficial for people who fall in the donut hole and may need to get out of a plan and get into another one to lower their costs. Lastly, a little bit here, we're going to talk a little bit about fraud. We usually talk about it in reference to the 4 R's. So the first one stands for record. Keep track of your doctor's appointments. Keep track of the services that you get. You know, especially if you're in certain situations where maybe say you're getting a CAT scan, an MRI, there might be a radiologist, a name. You know, just keep track of the dates of those things so that when you get your Medicare summary notices, you can take a gander at them and make sure that you're being billed correctly. Medicare will send out a summary notice. It's like an EOB, like an explanation of benefits that comes from regular insurance companies. They don't typically come out every month. I think it might be every 2 to 3 months. But they'll just list out every charge that was made against your Medicare number through Medicare. Just take a look at it. Sometimes people throw them right in the trash, but you know, take a look. Make sure Medicare actually paid. Make sure you were billed for things that you actually received. It's just a good idea to take a look through those and make sure there's nothing strange on there. If you are enrolled in a Medicare Advantage plan, you'll receive something similar through the Medicare Advantage plan, and you can call your prescription drug company directly and ask them, you know, to see a list of your medications if you needed to do that. If you happen to see anything that looks like fraud, call 1-800-MEDICARE and report it right away. You can also call the Inspector General's office. They have a form online that you can put it through. Right now, the big fraud that's going around is with Medicare and back braces. And these companies that are calling people on the phone and getting information from them and then billing Medicare for back braces that no one really prescribed for them. So a couple things. One, Medicare will never call you on the phone. So if someone calls you and says, we're Medicare, they're not. Medicare will always contact you in writing. And if they need to call you, they'll contact you in writing ahead of time to say they need to call you. They will never call you out of the blue. They will never show up at your door and knock on the door. They, you know.
So they have to call you on the phone.
No, they will not call you. No.
I've gotten numerous lately.
No. So if someone calls and they're asking for your Medicare information, that should be a red flag to just hang up on them right away. You know, if you've ever tried to call Medicare, sometimes you wait on the phone for 25 minutes. So believe me, they're not calling you, you know, on the phone. So don't give your Medicare number out to anyone that's not a physician or a service provider of any kind. Certainly don't give it out to anyone over the phone. If someone calls you and says they're for Medicare and then they ask for your Medicare number, that should be a red flag because if they're calling for Medicare, they should already have all that information. They should not need you to give it to them. Don't let, I mean, this seems pretty self-explanatory, but don't let anyone else use your Medicare card. And I said this already, but they will not come to your home. They will not call you unexpectedly. Medicare is not going to come to your house. Last but not least, there are laws in place towards sales tactics when it comes to Medicare-based information. It does not mean that it doesn't happen. It certainly does. But companies or brokers, insurance brokers, companies, they can't do high pressure sales. They can't promise you anything in exchange for you signing up for their plan. They cannot give you cash gifts or gifts that exceed $15, and they can't do door-to-door sales. So if you ever have somebody come to your house that's saying that they're there to give you insurance information and you did not invite them, then you can, legally, you can report them. Sometimes though, and this is again why I pointed out to make sure that you put in there Medicare.gov, sometimes because of the way these search engines work, you may inadvertently put your information somewhere that you think is Medicare. And in that case, you could potentially start getting a lot of information. So, just make sure that you're really looking on the internet at what you're looking at and where it's coming from. And is it sponsored through a company? Because, then that's going to be a lot of, one-sided information.